Welcome everyone to Vagina Talk podcast. We are Dr. Alexis May Kimble and I am Dr. David Kimble.
We're two double-boarded female pelvic reconstructive and cosmetic surgeons.
This is the podcast where we have honest conversations and discuss important and often misunderstood topics. Our goal isn't just to answer taboo questions or probe into taboo-related issues, but it's really to promote healthy discussions. Hopefully that'll lead to healthier lifestyles. Hi, everybody.
Hi.
Welcome back to Vagina Talk. I'm Dr. David Kimble, and this is my lovely wife, Dr. Alexis May Kimble. So this is called Vagina Talk by Drs. Kimble. So we developed this podcast because there's so many myths and untruths and uncertainties about all the things kind of surrounding the vaginal space, the vulvar space. So we wanted to kind of touch on topics with each and every podcast to really kind of delve into those myths, to make sense of all the information that's out there, what Google says, what friends say, what the next door neighbor, your local salon, all these things. Right. So today we're actually going to talk about vaginal rejuvenation. You know, this is something you see advertised everywhere.
Right. So let's start with something. What is vaginal rejuvenation? What would you say?
That is a mighty good question. So vaginal rejuvenation is one of these catchphrases that really is a huge umbrella. And underneath that umbrella are a multitude of different modalities for rejuvenating the vagina. So it could be a laser device, it could be radio frequency, it could be surgical intervention, it could be creams and lotions and potions and salves, and pretty much you name it, it could be used.
So rejuvenation is a word that's been used when we talk about cosmetics in other parts of the body. And when it was used to apply to the vagina, be applied to the vagina, rejuvenation sort of kind of got lost. Like everyone's like, what does it mean now? But essentially it's anything that restores, replenishes, revitalizes, makes it feel better, look better, work better, that sort of thing.
Absolutely. I think traditionally, most of our audience would probably think that vaginal rejuvenation is something that's really isolated to somebody saying, oh, I have had 4 kids, I'm 65, and things are starting to sag a little bit and fall south, which God forbid everything does. You know, is that the only time vaginal rejuvenation is appropriate? Is that so specific for vaginal rejuvenation? It's only for that patient population?
Well, I think that vaginal rejuvenation, certainly for that patient population, it's a common question because obviously the changes that are present thereafter are, sometimes are undeniable and very, very troubling. But I think it gained a lot of popularity because media sort of picked up on this. Celebrities, you have very famous faces talking about, getting things redone or restored or lasered. There's a lot of, catchy phrases like designer labioplasty, designer vaginoplasty, laser vaginoplasty, all sorts of things you've heard, which has made it really, really sort of very relatable to everybody, whether you just delivered a baby or you're a famous face doing, blockbuster hits or Netflix hits in today's world, right and left. It really, really is relatable and applicable to almost everybody who identifies as female.
So, I think that was an exceptionally good point that you made, whether you kind of intuitively thought about it or not, is you mentioned labiaplasty, vaginoplasty, laser, right? So here's 3 different things that can be done for vaginal rejuvenation. Is that the only thing that's available for vaginal rejuvenation?
Well, you and I both know that answer would be no, right? What would you say? How many treatments would you say we offer, for example, for vaginal rejuvenation?
Gosh, honestly, I would say well over 50 different potential treatments, whether it's non-invasive, whether it's maybe surgical intervention, or frankly, a combination of both, which is most common.
Absolutely. And I think that that's something that is really important to emphasize is that we offer so many different modalities to really rejuvenate your vagina and get the results that you're looking for. And so it's not limited to one treatment, or it's not limited to one condition, and hence it falls under an umbrella. And I think you broke it down very well. You know, it could be non-invasive, so non-surgical, surgical, or a mixed picture.
Absolutely.
Yeah.
Totally agree.
So along these lines, what would you say, Dr. Kimble? Would you say that vaginal rejuvenation, is anyone ever too young or too old to have vaginal rejuvenating treatments?
I would say too old, no, not at all. I mean, think of it. You and I have had 89-year-old patients come in because they have recurrent UTIs. Nothing can treat them. They've been hospitalized. Yet we can rejuvenate their vagina and stop the UTIs entirely. So no, I don't think it has an age limitation. Now, would I say a 2-year-old or a 5-year-old should have vaginal rejuvenation? Probably not. But now, have we operated on 2 and 5-year-olds? Absolutely, we have, for many different reasons. The vagina is closed off and they can't urinate. They are born without a vagina. They're born with abnormalities, congenital abnormalities.
Right, or creams we might use in that area to
So-
kind of help that.
Right, in truth, that's vaginal rejuvenation, right? We're restoring normal anatomy, restoring normal function. So yeah, I would say it has no age limit.
Right. So you're never too young and you're never too old. And if you're somebody that's looking to improve how things feel, how things look, wanting to make it stronger, softer, you know, more pleasing to yourself, for whatever
Looser,
reason.
tighter,
Yeah.
right?
Even, yes, looser. So
Mhm.
oftentimes people think vaginal rejuvenation is only to tighten my vagina, and they say, I don't need it tightened. But how many times have we had a patient who actually has a reverse problem? It's too painful to have intercourse because it's too constricted or too tight, whether it's because of a surgery, a delivery, or just
I was born
congenitally.
that way.
Exactly.
Yeah,
So it's
exactly.
the opposite as well.
Honestly, I'd say we probably operated on hundreds of patients or did non-invasive therapy on hundreds of patients who really had that issue. And that may be an under exaggeration.
Right, absolutely. Well, our whole practice is really dedicated towards vaginal rejuvenation, vulvovaginal conditions. So it can't be overemphasized that almost the overwhelming majority of patients we treat and see are for this indication.
Absolutely.
Well, we talked a little bit about sort of different types of approaches to vaginal rejuvenation. Is there any particular one that you think is the most interesting, or any sort of treatment? You talked about some lasers for recurrent UTIs, but do you have any favorites, or do you think there's something that could be very interesting to our listeners in terms of how it's done?
So yeah, most of the non-invasive treatments that we do are, I guess I would call it like lunchtime treatments.
Yeah.
You know, they're relatively quick, they're painless, there's no downtime. Is there any recovery?
There is really very minimal
No.
recovery time, no downtime,
Absolutely.
truly. Yes.
I mean, but think about it. Think about getting Fraxel in the face. There's a huge recovery. You don't want to go out of the house for like weeks because you're like, oh my God, unless it's Halloween. So this is very different. This is a space that, we understand the anatomy to an extreme level, and we know what lasers are safe, what they can do in the vaginal space. And that's really important because we know how to treat this.
Right, totally.
So yeah, I think lasers are amazing. It's revolutionized what we can do for vaginal rejuvenation. Before, maybe nip and a tuck, and that was really about it.
Right.
And that can solve some conditions, but not all of them.
Right. Or, people used to say that they're putting in like a husband stitch. You hear a lot of obstetricians say that, or even when I was in training, I remember learning that. And then obviously that was demystified, when I gained subspecialized, very advanced training, I realized that, that's just very mythical to think that we could rejuvenate by putting in, like a magic stitch.
But I agree. I remember in training, I would be like down at the bedside, I'd be with the attending and we get ready to deliver a baby, and baby would come out gorgeous and beautiful and crying. It was like such a privilege to be there. And then I'd see this father lean over and say, Doc, put an extra stitch in for me.
Right.
What?
Yeah. Totally.
I was like, oh my God, what's he saying?
Yeah.
It was hilarious.
Right. And the husband would get all excited and everyone's like, whoa, So yeah. And what would you say about pain? Would you say it's painful based on sort of your patient experience?
I always try to be super duper transparent and honest with patients. If I draw their blood, put an IV in, I'm doing some surgery to them, I'm always very honest about what you could truly experience. These are painless, pain-free.
Yeah, especially the non-invasive treatments are considered very painless, no downtime, quick recovery, immediate results. Truly, your body starts
Reacting to
restoring
that
itself
energy.
immediately
It's
upon
incredible.
contact with you. So
I mean, you're
it's-
really harnessing the healing properties of the human body, right?
it's exactly what it
We
is.
incur insults every day, things we can't even see occur inside our bodies.
Mhm.
Yet our bodies are geared immunologically to correct it, to cure that, right? So we're just using the power of the human body to
To
rejuvenate the
heal itself.
vagina. It's like
Exactly.
amazing.
It is amazing. It's regenerative, it's restorative. You're not using hormones or medications. It's really just a beautiful thing, truly.
Take it from my beautiful wife. It's a beautiful thing.
It's well, being a patient myself that's undergone vaginal rejuvenation by my wonderful dear husband and doctor, I must say that, after 4 kids, it's been life-changing for me. It's really allowed me to re-engage in a lot of activities. That was a little bit challenging after my third vaginal delivery with our very large child, who I felt like, tore a roadmap through me. That's just a figure of speech, but it certainly felt that way.
Oh, no doubt.
But a lot of the non-invasive therapies that I really have done in between my deliveries have made such a difference. Something simple like running is, really leak-free for me. And things are so much better in terms of my level of activity and things I could do. I don't really engage in a lot of very high impact exercises, but the few times where I'm jumping around, playing certain
With
jumping
kids.
games with the kids, I can actually keep up with these little
Mhm.
5-year-olds and 2-year-old munchkins, and I really see that difference after the first treatment we did
Mhm.
after my third delivery. So
Absolutely.
it's
I
been
notice a
wonderful.
difference. I mean, from an intimacy perspective, I notice a difference.
Okay.
Just
So,
that's on it.
yes. So, as a doctor, a mother, a wife, a woman, I really do think that these are just amazing sort of treatments that we can finally offer for these vulval vaginal conditions that for so long we didn't have an answer. We didn't always have an answer. What do we do about some of these things, these changes? We were very limited in what we can offer. So,
I think it's really important as a patient they know what their symptoms are. They know what they're feeling or not feeling if it's, things are too loose. So it's very easy to go on Dr. Google and try to research it out, even though Google didn't go to med school, to say, oh
Sure.
gosh, I need this or I need that. The most important thing is you got to see somebody who's an expert. You've got to see us. We're the ones that have that very unique understanding of this very delicate space. And we may be able to customize a plan, a treatment plan that covers multiple different modalities to get you to the point where it is as close to perfection as possible.
Right.
Where others may have a single device or 2 devices and say, oh, well, we can try this or that, but they're not specifically designed for that particular condition. So that's why it's really important. I mean, think about you, honey. Think about all the years of subspecialty training. Let's hear it.
Well, I have spent the majority of my life, adult life, in school
I know it.
and in very rigorous subspecialized training so that I can really understand these conditions to the degree, the depth and breadth that I do, and really gain the mastery, the technical mastery to be recognized as a master vaginal surgeon. And because of that, it is truly my area of expertise as well as my husband's and partner and best friend, confidant, like everything. My doctor even, but and because of that, I'm often consulted or recruited by media as well as national committees. I'm part of the national committee that helps develop guidelines to determine how these new emerging technologies can be used to treat complex vulval vaginal conditions that have been very distressing for women for a long time. So it's very important to, I think, seek the care and even the advice, even if you've done your wonderful research, whatever that means in today's world, to the public, it's important to really collaborate with an expert so that they can help you interpret and navigate all that information so you can make the right decision for you.
Absolutely, because the wrong decision can be disastrous.
Right, right.
You can really cause harm to the vagina and the vulvar area.
Absolutely. What would you say, with all the years you've been sort of in this space as well? I mean, you touched upon the disastrous things that can happen, but what would you say why it's so important to come to a surgeon like ourselves, or a center like ourselves that really, really specializes in these conditions?
Well, I think years of experience speak volumes, because I have seen virtually everything you can imagine you could see. I have done a whole host of many different surgeries. I have kind of created new specialized techniques to really minimally invasively treat a lot of these conditions and concerns, from really young kids to very older women, and it's worked amazingly well. I was chief for about 7-8 years at a huge institution. We trained hundreds and hundreds of surgeons.
Well, me less so, but yes, for sure.
But yeah, but
Together,
still,
yes.
you combine this, and we both do our surgeries together. I mean, it's the penultimate.
Yeah, it's
Why
wonderful.
wouldn't you come to us? Oh my God, I would
Yes.
come to us.
I do come to us.
Right, exactly. There you go. Love it.
But yes, for sure. I think that's an advantage, is that we're operating and we do a lot of our treatment plans together. We collaborate. So we're really able to put our minds and determine the best treatment we think would benefit you. And then certainly with our surgeries, it's amazing. I mean, we understand each other. Each of us are really experts in sort of our own area, even within the space. So when we come together, it's sort of like a tour de force. A lot of people even called our OR like a symphony.
Mhm.
So it's wonderful just to be able to operate with each other, do what we love, do what we're really good at, and do what we have proven talent and skills at doing.
And we were doing it this morning before we started this podcast, weren't we?
Yes,
Vaginal rejuvenation.
that's right.
Mhm.
It's our Monday special.
Love Mondays. Most people are like, oh, can't wait till Friday.
Yes.
We're like, we love
We
Mondays.
call it our Magic Mondays
Yeah,
because
for
we're
sure.
disseminating magic in the air by, restoring a vagina at a time to make life better for another female.
Oh, it means such a big difference.
Yeah.
It's incredible.
So we-
Such a privilege, really.
Okay,
Yeah.
well,
Hopefully we've kind of briefly touched on this topic and dispelled some of the myths that are out there. What really is vaginal rejuvenation? Is one device acceptable? Can you treat everything with 2 or 3 devices, or one type of surgery? So you understand now that that's not possible. You have to have a huge armamentarium, because there's a huge number of conditions that need rejuvenating in the vagina, need
Absolutely.
restoring.
right.
So yeah,
Yeah.
go ahead.
And one of the things I think is often misconstrued is that the vagina is its own entity. It's its own organ, just like the heart, the lungs, the abdomen.
The bones in the body for an
Yes.
orthopedic surgeon, positively.
It is its own organ. It's not just a neighbor. It's not just a bystander. It's not, just this vacuum or hole that a lot of people think it is. It's a potential space, its natural shape, right? But it's its own organ. It has its own histology, its own anatomy, its own blood supply, its own nerves, own way it ages and functions. So I think it's really important to just remember that just like how we put a lot of emphasis on care in other parts of our body, whether, it's our heart health, our health up here, our health in other areas. Let's not forget that the health and care of our most intimate area deserves
As much attention,
attention.
if not
Yeah.
more, if
Yeah.
not more.
Absolutely.
So we're going to conclude our podcast today. Thank you so much for joining us. As always, it's truly so much fun for us to do this. We're
Truly.
educators at heart, so this just kind of falls into a normal pattern for us.
That's right.
And if you have any thoughts out there, go on our Instagram. Let's, however you want to communicate that, Kimble Center, send us an email. We'd love to kind of touch on some topics that you want to hear about also.
Absolutely. And we thank those who have submitted their request via our podcast submission online on our website, www.kimblecenterforpelvicwellness.com. We also hope we've answered some of those inquiries that we've received as well. So,
Great.
all right.
All right. Well, we wish you a lovely day, and we look forward to seeing you with the next podcast.
All right. Bye.
Bye, everyone.
Thank you so much for listening to Vagina Talk podcast. If you want to learn more, you can find us on our web, www.kimblecenterforpelvicwellness.com. See you next time.
Bye.